Hi, everybody. I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, pigmentation, and I do a lot with facial balancing. Tonight, I'm going to talk about oily skin. I had a lot of questions about that over this past week. I promise I'll get back to it later this week. And so here we are with some tips for oily skin. So I'll go through just kind of like some things you could do at home, even without spending any money, especially when it comes to a diet. And also just recommend some topical creams, potentially oral medications if you need to. And in this case, this is with a laser called the Accure laser. So multiple different options. It just really all depends on how oily your skin is, what things you've already tried, and really kind of where you are with the acne and with scars as well. When we try to treat scars, when we try to manage scars, we really want to make sure that that oil production is under control, because otherwise you don't develop as much collagen as you may from something like patients with their oil is better controlled. So a lot of times there's an inflammatory process that occurs with oil production, and that could actually prevent a collagen response. So we're going to look at this patient right over here. He's somebody who is suffering from acne as well as oil production, but his biggest thing was really that oil production. Acne was relatively mild, but it was just like he was just saying that he was drenched in sweat, and it was really noticeable, especially in the summertime. So this is nice because over the course of a few months, we managed his oil really, really well with the Accure laser in his case. And you can see it just basically made his, actually looked more youthful. People seem to think that just excess oil really is going to help it so that you could age gracefully, but actually sometimes what ends up happening is that you actually could look a little bit older actually if it's too much oil. I think some oil of course is important, but like too much is never a good idea, because you could end up making it so that you don't develop as much collagen. Your skin may not be as as firm as you age too. Hi Ruby, how's it going? Good seeing you on here. What are some tips for oily skin? So a few things. Really, the easiest thing to start with is basically with your diet, like the easiest thing really. And I'm kind of surprised still how many people still drink cow milk, because in my mind it's really like pretty useless for pretty much everybody after a certain point, especially. And it's like, kind of shocking, especially for acne-prone skin, that it's still sort of like dismissed as if it's something that's connected with acne. Not just from the patient side, but sometimes I hear people that will say that diet doesn't factor into acne. And it was certainly like during when I was growing up, I used to drink a lot of milk. I was like, probably like 4 glasses every single day. And it likely contributed to my acne. It likely did. So one thing that's just an easy process to do is to really cut down on your dairy intake and try to just as minimal or nothing if you can. And you actually could have like a food journal. Like it sounds kind of, what is that? What does that mean? Food journal. Basically after you chronicle a certain food that you just sort of tried, let's say you try salty tortilla chips, and now you have more oil production afterwards, and now you know that that's something that does trigger oil, and now you can cut that from your diet, and it's just this like added incentive. I also notice that a lot of patients who are smokers actually tend to also have more oily skin. What that pathology is, it's not exactly clear to me just yet, but that's something else that's just sort of interesting. The other thing that's actually just a cheap something over the counter you could try to do is make sure that you're well hydrated, because if you're really dry, sometimes that actually causes your body to make excess amount of oil to sort of overcompensate for that. So that may be a reason why too. And then we also could do interventions like low dose Accutane, Isotretinoin, or in this case, the Accure laser. The topical medications that you could try to do is something like retinoids. So you could do tretinoin, you could do over the counter, you could do Differin gel, and you can just basically get that from a pharmacy and just start that. That's actually a really nice process. It'll take like 3 months or so to start noticing that oil production go down, but it's a nice process. And for women, you could definitely try to consider something with oral contraception. So particularly like Yaz is a good product, but there's other ones that are just estrogen and progesterone that will help, that could potentially help, especially if it's related to your menstrual period. Otherwise, also you could be on spironolactone. It's a really good product actually, because it helps with DHT, which sometimes could just accumulate in the body and cause more oil production. So there's a few different factors that we could take a look at, but if you tried these things and it's still resistant, then you may want to do something like a low dose Accutane or something like the Accure laser. All good options, really. But try kind of like those initial steps first. Let's see here. Blake is saying, I'm using tretinoin cream 0.5%, and I've been on it for 6 months and it's still very oily. Well, one thing, probably consider going up on it a bit. That's one thing, just to try to go on more of that max dose. But like I mentioned, if you are now kind of like feeling like it's resistant and you're pushing it, then maybe it's time to consider doing something like low dose Accutane or the Accure laser. So either option really, it could be really appropriate for managing oil. I'm on hormonal birth control and I have the copper IUD. Well, the copper IUD wouldn't really affect oil production, you're correct. But sometimes hormonal birth control, if it's just progesterone only, sometimes, like for example, the implant is just progesterone only, and that could actually cause more oil production. So maybe consider being on both dual estrogen and progesterone. And sometimes if it's you're already on that, then you could consider being on something like spironolactone. We don't usually do spironolactone for men because there's a concern that you get gynecomastia, basically breast for men. So that's why it's not recommended for men. But otherwise, for women, it's like a really great medication. And really, the other really nice part of it is that it also is like a cardioprotective, so it's good for your heart in the long term too. Let's see here. Where was I? Thoughts on Tazorac? Well, it's good. That's another way of managing your oil. It's another retinoid. And it's cheap, which is good. So I always like things that are relatively cheap and easy for people to use. So absolutely consider Tazorac there. Hi, everybody. Thanks so much for coming on. Thank you. Appreciate you all. I see some patients on here saying hello too. Thank you guys. Let's see where I was at. I have to pull up my comments here. When can my son go for scar treatments after his Accutane course, which is 60 milligrams a day? Good question. 60 milligrams is probably a little bit on the higher side. I usually want a lower dose before I start doing a lot of the scar treatments, but I'm okay with doing scar treatments while on Accutane. I just usually want it so it's better controlled, run a low dose, so make sure that it's not really just going to rebound right back as soon as you're off of that Accutane too. I'm not sure what your son's weight is, but 60 milligrams in general is going to be more of a therapeutic full dose. And so I'd rather prefer like a lower dose actually. Why do I have an oily forehead but so many fine lines? Good question. That's what I was referring to earlier, that oil does not actually mean that you're going to be more youthful. It's like a lot of people seem to think that you're more oily and then you're just going to age more gracefully. But actually, what we found is that normalizing oil actually stimulates collagen. So we don't want to overly dry your skin, but oil is actually an inflammatory process. And so, the inflammation can cause scarring. And sometimes those forehead lines are actually scars too. Like some people like express themselves so much that it gets etched in their forehead, it becomes like a scar. What do you think of cryotherapy after microchanneling, microneedling? Sure. I mean, I guess it sounds like it'll feel good, but I'm not sure if it's going to help much for most like actual medical conditions, but it could help, just make it feel good. How do you feel about beef tallow for acne-prone skin? So I had some patients that tried it. They said they broke them out. I had one patient said it was fine for them. It has some vitamin A in it, so it may be okay. But I haven't tried it. I wasn't really trusting the fact that, it was pushed by a bunch of people that had Amazon affiliate links usually. And I was like, I don't know. It was like this big trend that was like being pushed. I'm open to it. If some people say that it was working, I'll see. I was just kind of like myself. I was like, I don't know if I want to risk my skin with breaking out that. Juliano saying, do you recommend CO2 laser for scars while on low dose Accutane? It's okay. Yeah, we could do it. It just depends on how low of a dose, managing your acne, managing your oil production. All that is actually really important for us. But I do usually want it on a pretty low dose though. If it's a really low dose, then it should be okay. What age do you recommend for acne scarring treatment? I don't do patients less than 18 for invasive procedures for scars. So, beyond that, though, I'm open to it. If you're 18 years old, I'll be happy to help you out there. I've had 18-year-olds, 19-year-olds with very severe scars already. And it's like, what are we going to do? Just sitting around and waiting for them to have like more damage, to get the skin to get more lax? No, if they're like open to improving it and it's affecting their self-esteem, of course we could help with that. And I want to do that. I want to make sure that we could get there so that you could enjoy the rest of your life. Really do it early on and just enjoy the rest of your life. Why not? If you could do it, do it. Pimples on the face. Wait, I guess I missed a question here. Man is saying pimples on the back of the head treatment. So you may need a topical. And first of all, one thing you could try to do is something like Accure, which actually works really well, I think, for the body. It's a topical retinoid. And sometimes you also want to do, if there's a little pustules, you may need to do a topical antibiotic as well. Oral antibiotics, but a lot of times I find that it's pretty resistant, and you may need to do Accutane. Sometimes you have to do full dose Accutane. Sometimes you can get away with low dose Accutane. It depends on how severe it is, how thick those lesions are, how much oil production there is. So tough to say without seeing you, but there's a few options, and they do work actually. And it is important because you can get scarring even on the back of your neck actually. What oil can I use for gua sha for oily skin? I don't know. Actually, I never used gua sha, but I'm not sure if necessarily putting oil on your face is the problem. It's not because you're putting oil on your face that you get more oily. It's really because you're actually excessively dry. Oil is not going to help hydrate you pretty well, but want to moisturize, you want to make sure that you're doing things that are hydrating your skin. You're not overly exfoliating your skin. You'll be surprised how many people are overly exfoliating. It's kind of interesting because at one point when I was growing up, it was all this apricot scrub stuff that was going around, and then everyone realized not to use apricot scrub, and it was really bad for your face. It was really bad for my face. And then it was there's a whole nother push for this exfoliating polishes and all this stuff, and people got okay again with really harsh, irritating exfoliants, these physical exfoliants. And it was really stripping their skin barrier, and was making it so that they were getting more oil because of the fact that they were so dry. So I definitely recommend adjusting that, make sure that you're not using physical exfoliants. And if you want to do a chemical exfoliant, which is a good idea, but do it once a week, do a glycolic acid once a week. Don't do excessive drying. And a lot of the stuff, these guys that they're trying to sell this whole thing where they have exfoliants with it, they have toners with it, all that stuff. It's really excessive for your skin. Sometimes you just need water. Honestly, just wash your face with just water, and it's totally fine. It's in the morning, just wash your face with water. Sometimes people are just overly drying. They take showers that are way too hot too, and you're drying your face so much that what ends up happening is your body tries to produce oil to compensate for that. So a lot of those type of things actually need to kind of these other, not just medical issues, but kind of internally take a look and see what potentially is the reason. Is it because your dairy intake is just too high? Maybe just cut that out. Maybe it's because your hormones are just getting out of whack a bit during your period. And maybe you have PCOS, all these type of processes that we have to actually investigate. So it's not just here's the solution and this is it for everybody. Every single case is just have to walk through the history and make sure that that we've kind of solved, so this doesn't keep on happening over and over again, because it will just potentially happen again. People with oily skin, they still a lot of times still have oil production, even in their in their adulthood. A lot of people say, well, it was worse when I was a teenager, but I still have a lot of oil production. It's really bad at nighttime too and things. Ronnie is saying, hi doc, what's the best treatment for severe sebaceous filaments? Again, that's a lot of times actually one of the easiest thing to do would be to start with low dose of topical retinoid and start building up your tolerance for that. So that's probably one of the easiest thing to do. But you may, if it's excessive, a lot of oil production, starts, consider doing something. Actually, I have found for some of our patients with sebaceous filaments, usually they also had a lot more oil production in acne, but that did improve with something like the Accure laser as well. So something to consider there. Sunset in Life is saying, how long after consultation is the wait time for treatment for acne scar treatments? It's tough to say. I mean, I do about 3 every day, 3 to 4 a day. And today's case was actually amazing in the morning. Really, really cool case. I'll talk to you about that in a moment. But we're booked, I think, until May. Someone on here may know that's just recently booked it for us, probably May or so. So probably a couple months or so. And then we'll be happy to help you whenever we're ready. And you can always put yourself on a wait list or so, and then we can try to help you out earlier. Reese's Buttercups is saying, is acne scar treatment permanent, or do the scars surface up after a few months or years? Good question. So the texture you get to keep. That's your skin. That's yours. You get to keep that. So that's awesome. But you are going to lose a little bit of weight, lose a little bit of fat, lose a little bit of volume, and then you may still start to see some of that indentation again, because underneath there was a little bit of support for your scar tissue. The scars weren't gone completely, and there needs to be sometimes some things to support that. And if you lose a little bit of fat, you start seeing that depression a bit, and you start maybe seeing some of the scars. You'll find a lot of people will say that they found that their scars got worse in their 40s, for example. It's because of the fat loss, the volume loss. So a lot of times you have to do something for that volume too. By the way, I love the name, Reese's Buttercups. D-Lac is saying, what do you recommend 13 years old with blackheads or clogged pores? You could definitely, one of the easiest things to do is different cream. Just start with different. It's actually gonna start working really, really effectively for the oil production. But the blackheads, I do find that salicylic acid is probably one of the better options. And you could even do, if there's like little hair follicles there, you could actually do laser hair removal for those. So maybe something like that. Consider laser hair removal, actually, interesting enough, especially if there's little tiny follicles there that are trapped there. And it's like, something you have to keep up with though, with oil production. You got to make sure that, and it's tough at 13 years old, to make sure, keep on top of people to make sure they're doing that. It's really tough. Let's see. How do I get rid of rolling scars? So that's okay. So that's the cases today. I had a lot of rolling scars today. I also had a patient. He was ethnically East African, and he had very, very deep boxcar scars, ice pick scars, and some rolling scars. It was definitely, in the last couple of weeks, one of the toughest ones to do subcision with. I had to break that up really well. So deep rolling scars, subcision. One of the best options is really subcision there. If it's not so deep, then maybe you could get away with just like a little bit of Belafol or some sort of volume. But deep rolling scars, you probably need some form of subcision really to break up that scar tissue. Filipino slave, I hope you're not a slave. If I want to do fat repositioning from above my nasolabial folds to my cheeks, should I do that procedure before or after acne scar treatment with subcision? That's a good question. It's tough to say without knowing if that's actually directly going to help or not for your scars. It doesn't make too much of a difference from my end though, either way though. So, we'll see. I got to take a look and see though. I could tell you though, if it's going to help you, then ideally we want to actually make sure that we could do things later on for resurfacing, but at least that volume got improved, which is really nice. So, I have to kind of see if there's actually that's the biggest problem. And like, is there going to be enough fat when they put up there? Sometimes they still want to put some fat in there as well. Juliana saying you better quit those buttercups if you want good skin. That's actually so true. So I cut back on sugar almost completely. Actually, it was like a little bit here and there, but like almost completely on my birthday last year. It was like awesome for my skin, for my overall I found that like my energy got better. It was just there's a lot actually, but at least for at least for like health wise, skin wise, it's actually super important just to cut back on processed food. So Macho, how's it going here? So Matcha is saying, is the best treatment for boxcar scars filler and CO2 to soften the edges? I would say so. But sometimes if it's like chickenpox scars, sometimes you may want to excise those, or you do something called punch elevation. But those are pretty deep usually. It depends. It's like it has to be pretty deep, thick scars for us to really kind of do that. Otherwise, yes, you're correct. Just doing a little bit of filler underneath there and then using a CO2 laser on the edges there. That's a pretty good option there. Do you need more than one subcision session? Not with me. I mean, I'm like, today's case, I think was four subcision, really good cases today. And I was like, I got that very, very well, each of those patients. Like the first one today, this morning, I'm telling you that, it was East African patient, very, very thick skin. And, it was like, extremely tethered, but we were able to break that up incredibly effectively. Like when I was going in there, each bit was just like so tight, and so I had to use the Taylor Liberator in his case. I had to use a Nokor needle in his case, and blend cannula subcision, and eventually it was actually released properly. So, it's sometimes, you have to have multiple different modalities to actually break up that scar tissue. For those who don't know, basically subcision, we go inside the skin and actually break up the scar tissue when it's pulling it down. So sometimes you may see where there's like areas where it's like stuck and it's like pulled down. There's like fat loss over there. And when you smile, it's still pretty much stuck right there. The scar is pulling with that. So you have to go in there and actually break up the scar tissue a lot of times and manually release it. Usually the other cases, actually today I just did blunt cannula subcision, but in this particular case, I tried blunt and it was like incredibly difficult to break through any of that scar tissue. So then I used a tool, it's a sharper tool, and really precisely at those spots that were stuck, I just went exactly in that spot and just broke up that scar tissue. And then I noticed that it's relatively superficial now. There was still some scar tissue that was a little bit stuck, and so I had to go underneath and release that with a Nokor needle as well. So multiple different layers right there for releasing. Some patients just need that. Like you want to finish that and do that super effectively. He came all the way from Buffalo, so I was like, I have to make sure that this is, I mean, I always do, but like I wanted to make sure this is like done very effectively for him. Juliano saying, how long does diluted Radiesse stay in your skin? I have a lump since 6 months because of that. Will it ever go away on its own? Sounds like, sorry, Juliano, that ever happened to you, but it sounds like it wasn't maybe diluted enough, or it may have been an air pocket that got a little bit stuck for some whatever reason. It takes a while. It may take 2 years, but you may have to do other treatments to break it down. Very, very difficult to break up Radiesse. Sometimes you could do radiofrequency microneedling though. I did find that may help actually. Using that to actually, with that little bit of heat, it can potentially help out. But it's really tough. I know people will say that there's ways of doing steroids, things like that. I don't think that they're particularly effective. Will scars retether again? And this is actually good because I know Soul Macho was asking about this as well, about scars retethering. So I think it's really important just to kind of pay attention to what is why these tether bonds occur in the first place. So when you have that scar tissue with that inflammation that's occurring, around that inflammation as the skin is healing, there's this fibrosis that occurs, and then that fibrotic process is basically pulling down the skin. So is that going to occur again after you do subcision? It's difficult to kind of visualize why that would happen. You're sure when you go in there, is there a bit of inflammation? Is there a bit of fibrosis that could occur when you're going inside, breaking up that scar tissue? Probably a relatively mild effect of it, but it's possible. But whether that's going to cause enough for like a full tethering effect for the skin to pull it down, I don't see any evidence of that. I have never seen any evidence of that. And the reason why I'm saying I never see it is because whenever I've done subcision on these patients and I feel like it's just completely released, and if I have to go back in there for maybe some filler like Belafol or anything like that, it's very smooth there now. So it's very, very different actually. Like patients know that too. They'll see that like it feels very, very different now. And everyone sort of thinks that like all skin feels like that when you go underneath there. It's not true. It's this, there's a total different feeling when you have scar tissue. And actually, Soul Mantra brought up a good point. At some point, it's worth actually getting some imaging just to kind of lay that whole thing to rest, just to showcase to everybody that here's a bunch of patients that we do subcision on, and there's no more tethering. That's like a great study at one point I have to do. I would love to do that when I have some time, but in the meantime, it's like there's no evidence of it. And the people that say that there is, honestly, I found like really that they just weren't doing subcision properly and effectively. There's ways of doing subcision, and it takes a lot more work, a lot more energy than people expect. It's like you go in there and you break up that scar tissue. It takes a lot of energy to do that. And it's like you do it, and you just go in there highly focused and you can do it. And you watch a lot of people and they're not focused, and you can see it. And I've like, tried to train people like that before in the past and stuff like that. And you can tell that they're just not focused on the stuff. They're just not, they're not capable of doing it at a high enough level. And honestly, I always tell people that like, it's fine. You're not capable of doing this at a high level. Do something else. There's a lot of stuff that maybe like is interesting for you. You don't have to do this. There's so many different factors in the medicine that you could treat. There's so many other things you could do. But if you're going to recommend subcision, you better do it really, really well. Emily Hard is saying best treatment for a few ice pick scars on front of the cheek. Depends on the location. So if it's like near the nasolabial fold, likely it's just going to be mostly TCA cross, probably some laser. If it's more lateral, then you probably could actually excise those scars, so physically take out the scar, and then do some TCA cross and potentially laser. But lateral ones actually you like because you could just actually physically take those out. The middle ones, there tends to be more tension with those. And then when there's more tension, the scar may not heal as nicely. It just may actually cause the scar to get worse. It depends on the location. Have you always been highly focused, or is it a skill you've built? That's a good question, actually. I think it's certain things I always was really, really focused. It's just I think everybody has to kind of find the things that they could really that they can really focus on. So through that, actually, honestly, like take a look and see the things that you really do pay a lot of attention to, that you enjoy, and that like I think that term like passion gets like overthrown a lot. I think that's like kind of overused a lot. But I think that you could find things that you can like just like really enjoy, and like you could just do really, really well at a very high level. And whatever it is, and then kind of look and see what is it about that. So I noticed, for example, for myself, that like when I was building things, I used to always like build things with like Legos or like paint toys, do a lot of that kind of stuff. And so I was looking at it like I was very, very focused when I was doing those things. So it's like, okay, I like things where I touch, where I feel, and I can memorize really well that way. So, that ended up being like how I focus a lot then. But if you put like a bunch of text in front of me, like a bunch of books in front of me, and I'm just supposed to like memorize what page it's on, it's like, sure, I could do it if I have to. I had to do it for med school, but it's not really like the way I learn, and I don't really think it's great, honestly. I don't really think it's like a great way to learn either. So, some people may think that they have trouble focusing because like you're told to just memorize these books in front of you, and it's like, that's not how you learn. Like everybody learns very differently. And like find out the way you learn and like see it. And actually, I don't know if anybody's done it, or everybody's done it. You should do something that's called 16 personalities. Actually, it's pretty interesting. 16 personalities, like 16personalities.com or something like that. And go in there and actually see what personality type you have, and see kind of like what your style is. And it doesn't necessarily tell you exactly how you would learn, but it gives you kind of a good sense of like how like you should be taught in a way, and how you respond with like managers and things like that. It's actually a pretty interesting way of doing things. Let's do it. I should consider doing that. And appreciate you so much. So much is saying, so much as a patient, actually, I haven't done the follow-up yet, but I think it was maybe 3 weeks or so, saying, Dr. Qazi really reads your text messages when you're recovering from treatment and responds so quickly. Pretty darn amazing and accessible. Huge kudos to Dr. Qazi and his care for patients. I appreciate you. That's really high praise. Really, thank you so much for that. And that's why I try to just do a few things only, and do it at a very, very high level, because it takes a lot of focus, a lot of concentration to do things very, very well. I don't believe that like you should do a lot of things really. And that's, I think, for everybody. Like just take one thing from this, like trust me on that. You could do really, really well in life if you just stay focused on a few things and do it really, really well. And like just like those are the things, like it fits your learning style too. Because believe me, there's so many things at this that I have to continue to learn, really. And you guys come up with some ideas too, things like that. And I love it. It's actually like, okay, yeah, maybe there's some ways of looking at this that I can expand and improve. And I'm happy to. Actually, I'm totally fine. Like I said, this is pretty much open source for me. I'm not saying that like, I would say one of my main rules in life is never worship leaders. Never worship leaders. I have developed an expertise in this field, but there's a lot of room to grow still. There's a lot of things to always improve, and I'm happy to do it. Like I think that you should always try to improve, like always. Like that's actually like the biggest thing actually for people in life, just always trying to improve. So it's like, just be a good learner. Like, when you look at like kindergartners and stuff like that, they learn really well. They love to learn. It's like, I don't know why that gets destroyed, but in the school system, they crush that in people that you learn, and it's like playful and it's fun to learn. You're like learning through play. So like find that, because it's a really cool process where you can just keep on learning and keep on developing. And I'm like happy to do that. So yeah, never worship leaders. Star Rod is saying, tax refund came, going to book my consultation ASAP. Awesome. Good thing. I'm glad you're getting that tax refund. That's awesome. Good for you. Azelaic acid, good for acne. It's not bad, actually. It's probably not my go-to, but it's okay, like kind of in a pinch if you especially have like post-inflammatory erythema, those little red marks, works well for that. But I would find a tretinoin to be or just some sort of retinoid to be better. And then also a lot of times some sort of topical antibiotic. All good potential options. So this, for those just asking what we did for this particular patient, this was with the Accure laser. I was talking in general about all the different options you could do for oil, but this particular patient was with the Accure laser. So you can see, look at it, good improvement. He's really happy. It was awesome. It was like, we solved it. We solved his oil production, which especially in the summertime was really problematic. Would Radiesse help with acne scarring? I think you sent me that message. Sorry, I didn't see it. I figured you were going to come on at some point, so I appreciate it, because sometimes, the DMs, things like that, it's tough to catch up with. But Radiesse does help with it. Is I would do a dilute form of it, though. A dilute form of it. So basically, like a hyper dilute way of doing Radiesse. And a lot of times you still need to do subcision with it though. So to see how stuck the scars are, see what kind of scars. But if there is some volume loss, the best, if you're just starting out, you're trying to see would Radiesse work with it. Probably the best scars to help with will be ones where you see there's a little bit of laxity with the skin, like it's a little bit loose. When they're smiling, you see it's a little loose there. And then more with like boxcar scars. So those actually can work very, very well with dilute Radiesse. I'm scared of tretinoin because I don't want to purge, but I really want clear skin. What do I do? I would say, honestly, vast majority of my patients do not actually purge when they're on tretinoin because I tell them do things like omega-3s, zinc, and then also you could take Claritin actually. That actually helps as well. And then for the first week or two, mix it with a moisturizer. So mix that tretinoin with a moisturizer. Do that. Consider it. It's a really good option for you. All right, guys, thank you so much. It looks like a lot of people are asking some more questions. I appreciate you all, but I will be back here on Monday night. So